Think it's time to get started. Thanks everybody for coming and welcome to the new year of the Bullet Points Lunchtime webinar series on firearm injury prevention for clinicians. I'm Dr. Amy Barnhorst and I'm moderating today's session, and we're very excited to have Vicka Chaplin presenting today, and she's going to talk about firearm policies, the different impacts of various legislation, and why policy is a really important tool for public health and firearm injury prevention. First, a couple of announcements. Mark your calendars for the third Tuesday of the month at noon Pacific time, where we have our webinars. Just a quick 30 minutes. You can sit and eat your lunch while you listen and learn about firearm injury prevention. Our next webinar is going to be February 15th at noon, and we'll have more details on the topic in a follow-up email. We're going to start this webinar off with a poll and also close it with a poll. These are very brief and they help us understand where you're coming from, what you know as our audience, and what you learn from our webinars. And they also help us understand what topics would be interested to present on in the future. You'll see a question in the poll asking about your profession, and those who select other profession, it's helpful if you can write your specific profession in the chat for our evaluation, because that's a very broad topic. We really appreciate that. We're going to launch the opening poll for everyone to go through now. It'll just take a minute or two, and then I'll introduce our panelists. Great, I think that is it for the poll. Thank you everyone for completing that. And moving forward, you can use the Q&A function to ask questions. The chat will be disabled. I'm going to go through the questions as they come through, and if there's something really simple or a technical issue, we'll answer it in the chat or in the Q&A. But at the end, I'm going to go through and give some of these questions to Vicka so that she can discuss them further. So without further delay, I want to introduce Vicka Chaplin. She is the brand new, just arrived to us, Director of Education and Outreach here at the California Firearm Violence Research Center at UC Davis, and also with the BulletPoints Project. Her work focuses on making research accessible, understandable, and meaningful for firearm violence prevention. Vicka holds a master's degree in public health and counseling psychology, so she has both a clinical and a public health background. She came to us after 6 years of being the Director of Research Translation at the Educational Fund to Stop Gun Violence and the Managing Director of the Consortium for Risk-Based Firearm Policy, which is where I worked with Vicka and saw some of the wonderful stuff she was doing, bringing research out into the public, out into legislature, out into away from just the bench where it happens. So thanks so much for coming, Vicka, and I will let you take it away from here.
Thank you so much, Amy. I appreciate the introduction. I'm really excited to be here and talking with everyone today. Let's make sure I know how to work Zoom. Okay. So the foundation of this talk is the understanding that gun violence is a public health problem. I don't think this audience needs any convincing of that, but the latest data are staggering and just emphasize that this is a massive problem that needs to be addressed now. In 2020 in the United States, over 45,000 people were killed by gun violence in the United States. This was a 14% jump from 2019. This was the largest year-over-year rise on record. That's a hard number to think about. 45,000 is huge. What does that mean? What does that look like? If you've ever been to a professional baseball game, 45,000 people is more than a sold-out crowd at most major league stadiums. That's 45,000 people gone in 1 year from gun violence. So to quote David Satcher, if it's not a health problem, then why are all those people dying from it? We know also that so many people are dying, many people are harmed by gun violence and survive. It's much more beyond fatalities, but it is very clearly a public health problem. So the big question here today is why use policy approaches for firearm injury prevention? And my short answer is that we can't afford not to. It's a major threat to public health. Right now, it's getting worse. It's getting worse quickly. The longer answer, though, is that addressing a complex public health problem requires a broad array of interventions that address risk factors and protective factors, and policy is one important avenue for that. So what we're looking at now is called the health impact pyramid. It helps just to conceptualize how different kinds of interventions can have different outcomes and at different levels of individual effort. This is used in a lot of different areas, and it's a framework for public health action. At the top of the pyramid is counseling, education. One level down, there's clinical intervention. Those are individual level interventions. They require a lot of individual effort for behavior change. And then we pair those with those broader interventions. They help mitigate risk factors, change the environment, or at the very bottom, directly address the root causes or social determinants of health. And all together, that will create our multi-pronged approach to prevention. Now, policy can be used at each level of the pyramid. It can be used to support at the top those individual efforts and is more and more required for action at the base of the pyramid. So I want to think about some of the benefits of policy and why policy approaches are valuable. So like I said, they provide support for interventions at the top of the pyramid, funding, education, things like that. It also can fund research to better understand the problem and all of the solutions across the pyramid. But policy is important in other ways too. So it requires a lower individual effort. If you think about this for a little bit, think about a habit that you'd like to change, a health habit that you'd like to change. Maybe you stay up late when you should be going to sleep. Maybe you spend too much time scrolling mindlessly on social media, or not flossing every day, or not drinking enough water, things that we know that we should be doing, everyone should be doing, and changing these behaviors are good for our health, right? Think of the thing that it is that's there for you. What comes to mind? These things that I've mentioned, at least they're not very expensive. They're not challenging to master, but old habits die hard, right? Those things are hard to change, even when we know they're simple and they're good for us. Now, imagine if the people around you were telling you it wasn't a bad habit and that it wouldn't help you, or maybe that it would make you less healthy if you made that change, or less safe. That would make it a change that would be even harder. And so that's sort of the context that we're looking at, that behavior change is hard, especially when there's a culture that supports continuing in that behavior. And so policy can come in by changing that environment. It helps make it easier to make a safer choice, changing an environment, changing the culture, changing the options for that choice. And in that, it also can support long-term change and long-term effects. Finally, research, there's plenty of research that demonstrates effectiveness of policy in increasing injury prevention measures and decreasing injury outcomes. So we'll get a little bit into some of that research later, but we just know that policy can be a really effective tool in injury prevention. So this is Haddon's matrix with Runyan's third dimension. The Haddon matrix is an injury prevention tool used to develop those injury prevention strategies. It's the first 12 grids of the flat face of the grid that you're looking at with the phases and factors on it. It was first introduced in 1970, and it was used to develop strategies to address traffic safety. And I say that because this has been going on for a really long time. Just the public health approach, and then increasingly policy interventions to address public health problems. It's been used in many different ways since then, but I wanted to actually include it here because of that third dimension that Carol Runyan added in 1998. That expansion, that is a decision criteria. That's a third dimension going sort of back across the diagram. And that's important in aiding decision-making in any sort of intervention design, but also for policy considerations so that you can help explore the pros and cons. And those 8 factors are effectiveness, cost, freedom, equity, stigmatization, preferences, feasibility, and other. And I want to talk a little bit about freedom. This, of course, comes up in gun violence. Every time that there is an issue in firearms, we are always talking about freedoms, right, in the Second Amendment. And one of the things that Runyan pointed out in her paper introducing the third dimension is specifically about freedom, and that freedoms they're complicated. It's often a judgment call. Some other areas we may have clearer data, but freedom is often a judgment call, and it's often going to be a pro for one group and a con for another group. So she actually used public carry of firearms as an example in her paper, and that there is a group of the population that will want to be able to carry firearms in public, and another group they want the freedom. I'll use the word specifically. They want the freedom to carry firearms in public, and another group that will want the freedom from being around other people with firearms in public. And so when a policy is passed, whether it is supporting public carry or limiting public carry, one of those groups will gain freedom, one of those groups will lose that freedom. And so there's always a trade-off and a debate there, and it's part of why policy doesn't get passed overnight. It's complex, and a lot of different considerations must be made. So these are, my notes aren't showing up. So death rates for motor vehicle traffic events and firearms from 1950 to 2020. As you can see in red, that's motor vehicle crashes, quite high. It's a leading cause of death for many, many, many years. Gun violence also, and went up in especially the 80s and the 90s, and came down and has been coming back up again. You'll see in those last 4 years, firearm deaths have exceeded motor vehicle crash deaths for the first time and are increasing. I'm sorry, these are the death rates. And something I want to point out here is that in 1966, which is about where I put that arrow, I think I got it on the right line, don't quote me on that. That's when Congress passed the National Traffic and Motor Vehicle Safety Act and the Highway Safety Act. And those were the first major traffic safety legislation pieces that we saw. And from there, that's a big marker in the public health campaign to increase traffic safety and reduce motor vehicle deaths. And you can see that with some ups and downs over time, that sustained public health effort was effective. And my notes aren't showing up, so I can't give you the direct number right now, but millions of deaths have been averted by that effort over all of those years, that sustained effort. Now, that included a great deal of different kinds of interventions, including different policy interventions. It included policy that mandated safer manufacturing, safer vehicles, speed limits, restraints, child safety restraints, drunk driving laws, all sorts of policies that came together to make a safer road environment that reduced deaths. And so now, how do we do that in gun violence? So to do that, we're going to look back at the health impact pyramid. And this is an image from the Educational Fund to Stop Gun Violence, with that classic health impact pyramid filled in with some ideas of how that looks at gun violence prevention. Now, this is not a comprehensive list of interventions at each level, but it's an important way of looking at how many different kinds of approaches we can have. So how can policy play a role in all these levels? Well, to start at the top of the pyramid, legislation can fund the research to learn what works best and support the development and dissemination of safer storage campaigns and firearm training courses. What works best? What's most effective? It can also mandate training for different people, maybe firearms owners, or different situations like lethal means safety counseling. We want to make sure that clinicians are well trained and have the education that they need to provide that for their patients. There's all different kinds of opportunities that can come in for legislation to support interventions at those levels, either create new ones or support the ones that are already happening. In the middle of the pyramid, there are many laws around firearm access. I'm going to talk about a couple of those in the next slide. But things like extreme risk protection orders, universal background checks, licensing, and repealing laws like stand your ground. And then at the base of the pyramid are social determinants of health. And I'm not going to go into those further in this presentation, but those are policies and actions that address the root causes of violence, and violence prevention is not complete unless those that base of the pyramid, the real foundation of this issue, is being addressed. So the big question, right, is do they work? Do firearm policies work? And of course, that's a trick question. It's oversimplified because it's not a one size fits all scenario. But yes, we have clear evidence that there are many effective policy interventions and ways that policy can prevent gun violence. So I'm going to talk just briefly about 3 specifically that I think are really important. And these 3 all work in one very sort of in different ways, but all to regulate access of firearms by people who may be at risk of violence. The first one is really broad firearm licensing laws that they require obtaining a license prior to purchasing or owning a firearm. What that means is it's promoting responsible gun ownership, that people who are then able to go through the licensing process have met the set of criteria by the state to show a level of safety and responsibility in owning a firearm and possessing that. People who are prohibited from owning a firearm by law already will not be able to get through that process. There's clear evidence in multiple states that this reduces gun homicides and suicides and trafficking. 2 states that are commonly brought as examples are Connecticut and Missouri. Connecticut, when they passed their licensing law, it's been associated with it's 28% reduction in the state's firearm homicide rate and a 33% reduction in the suicide rate. Missouri, on the other hand, repealed their licensing law, led to a 25% increase in homicides, I think in the first 3 years, and a 16% increase in suicides in the first 5. So by adding in a licensing policy, had clear reductions in gun violence, and by taking it away, then we saw the reverse. We also see impacts in trafficking, that's diversion into the legal market, since when you are licensed, then there's a connection of you to that firearm purchase and point of purchase, and so fewer of them are diverted. Next up, I want to talk about extreme risk protection orders. Those are court orders. They temporarily remove firearms by people who are posing a danger to themselves or others. They're based on behavioral risk factors. Those are all evidence-based. And the evidence there is also clear. For every 10 to 20 orders issued, 1 suicide is prevented. This is, for some people, a high bar, right? If the concern is removing a firearm, then 10 to 20 firearms or 10 to 20 cases where firearms are removed. Actually, I should rephrase that. And firearms are not removed in every single case because they also can prevent the purchase of new ones. But for 10 to 20 orders issued, a suicide is prevented. Again, if the concern is that there's an order issued, then that person might think, oh, well, for the other cases, then that could be a high bar. From a suicide prevention standpoint, that's a pretty effective reduction in suicide. And so I would argue that this is a really effective place to be, and a very targeted intervention with a small and temporary impact. And the goal of that, and why it's important to be temporary, is that risk subsides. It's here during a high risk period, and when risk subsides, a person can get their firearms back. There's also evidence suggesting a role in preventing mass shootings. There needs to be more there. It's more research there, and it's hard to tell. Mass shootings are rare, but there is evidence from a research study here at UC Davis showing that they are being used in California in cases of threatened mass violence. And in the study period, none of those threats of violence were carried out. Finally, I just want to talk a little bit prohibitions in cases of domestic violence. There's a very clear link between domestic violence and firearm violence. Access to firearms makes domestic violence situations extremely lethal. Reducing abusers' access to firearms is an effective way to reduce gun violence. This is in cases of domestic violence misdemeanors, in protective orders, both temporary and permanent, closing the dating violence loophole, the dating partner loophole. There are a lot of different approaches in that domestic violence realm, but by making sure abusers don't have access to firearms is one really clear policy approach to reducing gun violence. So I do want to talk about some cautions. When you're thinking about a policy, there are some questions to ask. Is the policy evidence-based? For example, if it's a firearm removal law that's based exclusively on like a mental health diagnosis, that's not a strong policy. It's not evidence-based. It's also going to bring equity issues. And you should also be thinking about equity issues. Are impacted communities involved in leading these projects? Do the communities that would be impacted by a policy, do they want this policy? Is there support for this policy? I also want to ask, has the policy been evaluated? Was it implemented effectively? If someone is making claims about a policy, we want to make sure that the policy was implemented effectively and equitably before we draw conclusions about it. And finally, what's the context? So policies like background checks, on their own, background checks are not a strong preventer of gun violence, but they are a foundation for other policies and they're required for those other policies to work. So universal background checks are an important foundation in the gun violence policy sphere. So understanding those questions and the context around the policies is really important when you're trying to understand a policy and whether or not it works. And finally, quick note, not all laws are helpful laws. So I want to talk a little bit about stand your ground. Stand your ground laws are in place in over half of US states. They have been demonstrated repeatedly to be not only ineffective as a crime deterrent, but they are harmful. They increase homicide, they increase firearm injuries, and they exacerbate racial disparities, both in gun homicides and also in inequitable legal defense. So the people who are harmed and the people who gain from a policy like this is inequitable. So that's just another piece to think about. The policy landscape is not just getting good laws in, but it's getting bad laws out. And finally, a little bit about the role of clinicians in firearm policy. I know we're running out of time for questions, but I want to talk about 3 different areas for clinicians to get involved in firearm policy. The first is education of yourself and for your patients. Also participating in the policy development process and then getting involved in advocacy. So first on educating yourself, what do you need to know? That's really going to be a personal practice question for you. What's relevant for your clinical practice? Do you have to know everything about every policy? No, you don't. But what's relevant for your patients where you live? Maybe you work with kids and you should know what your local child access prevention laws look like. Are you counseling suicidal patients? Then you should understand your local regulations on temporary transfers of firearms for suicide prevention. Understanding that local context and what's relevant for your patient population is going to be really, really important. And I just have a couple of resources here to get you started. There are plenty of great resources, but I personally would recommend the BulletPoints project, especially on counseling. It also has a lot of links to important scholarship on ethics and legality of having conversations about firearms with your patients. So that's a really great place to start. The Giffords Law Center has great local law information. So if you want to go state by state, start there. And then the Educational Fund to Stop Gun Violence has a resource with a lot of in-depth information about specific policies and why they work, what's the research behind them. So next, contributing to policy development and evaluation. As Amy said in my introduction, this is where I'm coming from, so I have to give a plug for that. But you can work with research intermediaries and policy development organizations. You can work even with lawmakers in some cases. If you are a researcher or researching is part of your job responsibilities, then you can help to translate and apply your findings and your knowledge. I promise you, if you aren't the one doing that, other people are doing it and they will do it for you. So this is an opportunity for you to control the narrative about your own work. You can also contribute to evaluation. And for clinicians, you can also lend your expertise in that policy development process, help the policy developers understand clinical implications of policy and in your specific area of expertise. You can also help with implementation and evaluation efforts. And finally, getting involved in advocacy. Why do this? And that's because your voice is really important. You are an expert, you have your experiences with patients and your voice as a healthcare provider. It's important. So is your voice as a constituent. And legislators need to hear from constituents and experts alike. And so in both of those spaces, that's important. And then where would you look for policy advocacy? I want to remind everyone about two different kinds of policy. Big P policy is what I've mostly been talking about and what I'll talk about in my next and final slide. That's legislation at the local, state, and federal levels. Also applies to funding. That's big P policy, but there's also little p policy, which you may already be involved in. Those are your institutional and organizational policies. They're determining priorities, practices, and distribution of resources. That's an important place for you to advocate and get involved. A lot of times change starts locally, change starts small, and that's a great place to start. And finally, how to get involved in advocacy. Things to remember are quality over quantity and building relationships with those change makers. You can take on action solo, or you can join with colleagues, partner organizations, advocacy organizations for collective action. And you can get involved in both direct advocacy or indirect advocacy. So direct being where you're communicating directly with those change makers, and indirect advocacy is in changing and educating the public, friends, family, voters. So you have to figure out what's right for you, what fits in with your expertise and your life. But there are tons of resources to get you started, and you just have to figure out where you want to go with it. So that is my presentation. I know we don't have a whole lot of time. Sorry for going long. I have not been here in this job long enough to have an email address yet. We're still working on that, but you can find me on Twitter at Vicka Chaplin, and you can follow the Bullet Points Project there too.
Awesome. Thank you so much, Vicka.
Yep, you're welcome. Thank you.
And we'll have a real quick ending poll for everybody before we get to some of the great questions that are popping up in the Q&A. So if you just take a minute to complete that poll. And I know our webinar is supposed to end at 12:30, but these are recorded, so we'll take a few minutes to answer some of the questions. And if you're not able to stick around, you can always go to our website and access our video library and see what discussion took place after you left. I'm going to work through, we got a lot of great questions, so I'm going to work through some of these in no particular order. So one is, have you thought in more detail about what licensing qualifications should be and how that certification should be maintained?
I don't have that on the top of my head, but there's excellent research being done on that right now. And there's great resources that go into more detail on what the evidence says about that. I would currently send you to the Educational Fund to Stop Gun Violence and to the Giffords Law Center, I think for great resources for more information on that. And I know that there's actually research forthcoming. So I'd also say stay tuned on that, because I think as we learn more, and also looking at licensing and racial equity and its impacts, I think more is going to be coming out soon.
Great. Can you comment on child access prevention laws?
I don't have a lot on child access prevention laws. I'd have to look further into it. I hate to say that that's not an area that I have worked in. And so I don't have, I'm not fresh on the data and what's there, so I wouldn't want to stray out of my area.
Okay, great. This is an interesting one, but have you thought about in detail what could be contained in an effective background check to make those policies actually have an impact?
Yeah, so that's a really interesting question. Background checks are kind of fraught because I think we're still working to get universal background checks. It's been since the early 90s has been this effort to get universal background checks passed. Right now, you don't have to go through a background check to buy a firearm in most places. There are loopholes all over the place. You can buy them on Arms List and other places online. And there's all sorts of ways to get around background checks. And those are big gaps. And so that's a first step, is making it harder to get around a background check and actually having universal background checks. But what the evidence is showing is that strengthening background checks by going into more of a licensing or permitting system, that's where you strengthen the policy as a whole. So I think it's closing the gaps that are there already, so that landscape is more universal. And then and that also helps with trafficking, because right now it can be really easy to get a firearm in one state and then you can bring it across the border into the other. And so trafficking comes in there too. So if you can make it a more universal policy, then it helps start to fill in the gaps.
Great, thank you. Another question is, in your intervention pyramid, what rubric did you use to select the policies you favored out of the many that have been proposed? And how do you weigh feasibility, possible benefit, burden, et cetera?
I think this is referring to the health impact pyramid. And it's just an example. My former colleagues, who are wonderful, created that example in talking about the public health approach, but it's not intended to select some over others. They're just examples that each level of the policy. And in terms of a rubric for evaluation, I actually think Haddon's matrix is a really great place to go. That third dimension proposed by Runyan is a really great place to start looking at it. And there's also a lot of work being done on how to evaluate equity, and especially racial equity, in firearms policy. And so I think that's another space to begin looking at policies when you want to explore their impacts in the real world.
Okay, and we'll have time for one last quick question. Do you advocate on firearms education for clinician in addition to policy education, the idea of the credible messenger approach?
Sorry, can you say that one more time? Do I advocate
do you advocate for firearms education for clinicians in addition to policy education with the quote unquote credible messenger approach?
Yeah, I think that let me take a step back. So I think that you can be credible without being an expert in everything. I know that I am not going to be that expert in everything. And if someone wants to talk to a firearms expert, I'm not the person to talk to. Even in these questions, we know I'm not the expert on every single area of policy. I don't have every answer all the time, and that's okay. We don't have to be the experts in everything. And so clinicians don't have to be experts in firearms in order to counsel their patients on how to be safer. A lot of that process, and what's important, is figuring out what works for the client and for the patient. It's not what works for the counselor. So that's one side of that answer. At the same time, one of the biggest barriers for clinicians in providing counseling is a lack of familiarity with firearms, or perceived lack of familiarity and lack of confidence around talking about firearms. And so I definitely think that should be an opportunity for those clinicians who want that to be available, because it can help make them a better counselor and help them, relate better and work better with their patients in talking about firearms. So, having that opportunity and having the basics there at least is I think an important start. Now, there's a lot of variation in comfort and desire in going to the range and shooting, but it's definitely something that I would recommend for people who are going to be working in that sphere.
Great. Well, thanks, Vicka, for all of that great info. And thanks, everyone, for your excellent questions. I again want to thank you all for joining our webinar series, and look out in your email inbox for a follow-up email with the recording for this webinar, and also for February's webinar registration link. And hope everybody has a great rest of their January. Thanks so much for joining us. And thank you, Vicka, for presenting. That was awesome.
Thank you so much for having me.